People are excited, and I think between most of our clinics that we have over the next 72 hours, I think they're pretty full. I think we opened up some more slots for the Saturday one, but we brought on Kinney's to do a second one that day because of people wanting to get the vaccine. And that's, for the last 2 weeks, it's slowed down, so this is exciting.
How many shots is that then over the weekend that the county's going to be
I think
giving?
with us, the number will be have, at least 1,500, probably a little more.
With the CDC guidance, I know that you said you still have to go through it, but what should businesses expect when it comes to, local rules surrounding mask wearing?
Yeah, we'll go through it. We'll have Dr. Gupta go through it and give us some good feedback. But I went through the executive orders that I've signed today. There's a couple of them we're probably going to give up. There's a couple we'll keep on because I think they provide a benefit to the community. Outdoor dining at restaurants, things like that. But this is the organization our country leans on to give us best practices, and so what they say we should adopt. And if they, and I think we know what they're saying from a macro level. We just need to understand all the details. What are the circumstances that they say they still think you need to physically distance or you need to wear masks? We'll just follow the science, and I think what I'm happy about is everybody's getting to where we need to get to. This is going to help us with vaccine hesitancy, by the way. When you have muddled messages from your levels of government and things, you can point to things that are hypocritical. People who are like, hesitant about the vaccine are like, why would, nothing's going to change. Why should I go get it? Well, now, if you're vaccinated, you take the masks off. CDC is saying that. That's all right. That's pretty good.
What's your message to people who aren't vaccinated but might take advantage of this updated guidance, basically on the honor system?
Well, look at that's good question, Andrew. It's tough to enforce a lot of the stuff anyways, so I don't think people are going to be asked to wear a pin or anything, a V pin or anything like that. It's kind of ridiculous, but folks should just get vaccinated. I have, so most of our workforce has been vaccinated. I hear stories about the one or two people that aren't doing it, and I've heard stories about some of these folks that have gotten COVID. Like, it's not worth it. Get the shot. We got the supply. We'll get you your shot, and then we can get back to normal faster.
People are going to hear from President Biden, it sounds like, after they hear from you. Do people take masks off tonight? Should they go to Wegmans tonight without a mask?
Well, let's see. I haven't seen the guidance, so I don't want to get out in front of the president, but I'm assuming he's going to probably address it. I know outdoors, I've been vaccinated. I don't wear my mask outdoors. So I think people, the science says that's okay. So that doesn't mean someone that still wants to wear one, anyone should look at them differently. They still want to wear a mask, that's fine. But I'm looking forward to this. If the vaccine works, and we know it does, the data tells us it does, then we need to find that balance again, which has always been the goal during the pandemic.
Ryan, SUNY ESF is having its graduation at the amphitheater. Have you heard from high schools? Is there any chance that some high schools might be able to take advantage of that venue as well?
Yeah, so we have, and we've talked to multiple high schools, Terry. For both SUNY ESF and the high schools, we cut our costs down to just cover our costs for the people we have to hire literally to work at the events. And I think we have, it's not my announcement to make with some of the high schools, but I do think we have at least 2 high schools that are going to have a graduation ceremony there. Certainly we're excited to have SUNY ESF there this Saturday, and it'll be nice to see that facility being used. But we've offered the facility at cost to the high schools and to SUNY ESF. And certainly we've talked to probably 6 of them. I think there's a couple that are committed, a couple more that are weighing their options.
With the high schools, there's that clinic that you mentioned at Fowler on Monday. is that just for students, or are people in that area also signing up there?
So for the 13204 zip code there too, I believe that there is, you'll see, one of the things we learned with our clinic we had at ITC is we had a lot of walk-ups, which was awesome. And so we then worked with the school district to work on a time that they thought would be effective. So we'll get students, but we'll also get adults as well. So we're happy about that. That's a zip code that we can continue to need to do well in.
We saw that the same trend with walk-ups at the Olivet Baptist Church as well. Are there plans to have continued pop-up sites there?
Yeah. So we will until we're done. We're gonna that will be the distribution model mainly for us. Will be pop-ups.
The city school district lists NBT Bank Stadium graduations for, it looks like June. Is that-
NBT Bank.
NBT Bank
Wow.
Stadium.
That's one of ours.
Yeah.
Okay.
Is that news to you?
You broke some news. Yeah, that's great.
So, I
Very-
mean, it
very
sounds
excited, yeah.
like schools are taking advantage of the county's offer.
Yeah. We have great outdoor venues, and so that's where we've had the most success in this pandemic. And so again, for us, it's not about making money on this. It's about providing a great venue so that these students can have a great experience. And all we ask is that they cover the cost of the people we have to hire for their event.
It's on their district calendar, too. So
Awesome.
you don't have to take my word.
The superintendent, a good decision by Superintendent Alisea. Well done, Jaime.
I could ask a question of Dr. Gupta.
Yes.
I don't
You
know.
can. I mean, you might even be able to bring the microphone over to Dr. Gupta. Old school.
Give
Old
me
school there.
two jobs.
Yeah. Yeah.
Better to make you get up there. Just while I...
No, can we bring her to the podium so we can
Yeah,
see
Dr.
her?
Gupta, come on up here. I'm teasing.
I didn't
Come
want
on
to
up.
say it.
I'll be
Connor,
the
you
bo-
fell for that.
I'll be the bossy one in the
Yeah.
room.
What?
She wore the color of her mask, too. Look at that.
Yep, matching.
So the county executive mentioned it a little bit in terms of it helping with, it's a little bit of an indirect incentive to say that there are more benefits in terms of, moving towards more what we understood to be normal now that you're vaccinated, the possibility that we can take our masks off if people are vaccinated. What would you say to people who look at something like that and say, oh, well, the CDC and other of these, national leading scientists were wrong about things before, or this misunderstanding maybe that it's a developing science. Would you be able to talk through sort of how the data has worked for this?
Yeah. So you're talking about, the incentives have put forward to entice people, maybe for the vaccine reluctance, that they are kind of there but not there. So maybe this incentive will break that little ice, and then maybe people will do that. So it does work to a great extent. This is not a new style. I would say that in public health, incentives have been a part of public health work for ages. This is not a new thing. They could be small or big. Incentives are always part of a good public health work policy. What I think its incentives are combined with the facts put forward by doctors like myself, or the people's own physicians, or the pastors, or the trusted messenger, that vaccines are safe, they're effective, and they don't change your DNA. They are using the new technology, but based on the old science, which has been out there, whether it's mRNA, whether it's adenovirus, and they actually do not cause infertility, and they are accepted and pretty much taken up by all the physicians or the healthcare community. Like, I'm vaccinated, my husband, who is a physician, is vaccinated, his friends are vaccinated, most of the doctors I know, they're vaccinated, nurses are vaccinated. So we look at the facts and the science. So for us, the incentive was that we want to continue to take care of people and then keep our families healthy. But it may not be big enough for some people, so they want more facts. So these facts are important, and bringing back to normalcy is that very important part. As you are asking, the mask mandate, CDC has just come out today and said that if you're vaccinated, you really should feel comfortable not putting the mask on, especially in outdoor settings, some indoor settings. That is a very big incentive on top of it. So you have some, goodies you can take it, which is good. Hey, I would like it if I want to. If somebody gives me after a vaccine, you go and get some nice appetizer, and why not? It's a good thing. So it's a combination which work. You get the facts, you get the incentive, and you get something to people to hang on to so they feel good about their decision.
Dr. Gupta, what's your initial reaction to the CDC updated guidance?
It's great. I think this is something which I have been asked this question in last several days. Actually, I have done a lot of outreach in terms of vaccine hesitancy, and which is a common sense that if you know people are vaccinated around you, you really do not need vaccine because you're all good. If you have any symptoms, of course, then you follow the same path because some of those people can have breakthrough infections that we know. But it's rare, essentially at this point, very small percentage. But in general, if your family or friends or a large group, if you know all are vaccinated, that's what the normalcy is. But if you are going to walk in somewhere where you don't know how many people are still not going to be vaccinated, because our vaccination rate is about somewhat 50%, and in some zip codes it's 60%, so we have to kind of still be cautious because pandemic is still here. When you look at Brazil and India, you have mutants of the virus. So we are just trying to have more and people get vaccinated so that we can have this wall of our defenses with the antibodies and memory cells, which will make us more strong against this virus. So it is very crucial that we make that judgment call and tread it gently because, once it comes, it becomes a problem. So be cautious and enjoy. I think when you're outside, certainly, there's no reason to use the mask at this point, especially, I would say that I don't wear it right when I'm going from my office out to the parking lot or when I'm going. If I go to Wegmans, I'll wear it because I don't know how many other people are not vaccinated, so I will just do it as a caution and respect to others. It just, it makes sense. And in the hospitals, that's important.
I've seen Dr. Gupta in Wegmans. I know she wears her mask there. So you're giving people, though, I think the guidance that might be missing right now. You don't have to wear a mask when you're with people you're comfortable with, you know that they've been vaccinated.
Yeah.
But still in those general, where you may not know everyone, there might be more than a certain number of people. You
Right.
think the mask is still a good option?
Yeah, so if you are, let's say you wanted to get together on Friday night or Saturday, right? So you have all your friends who you know they're vaccinated. Oh, have fun. There's no reason to have the put mask on. You can sit next to each other. You can enjoy because you have done everything which you know to protect each other. That is important. If one of your friend is not vaccinated, things will be a little different. You will, of course, encourage them to get vaccinated, so not everybody has to wear the mask now. And that, it kind of changes it there. So this is applicable at workplaces. And CDC guidance, even before that, they have put it out for the indoor settings also. If you have people vaccinated within your group or within your office space and you feel comfortable, then go ahead. And some people still are not feeling that comfortable taking the mask off. So that is it's common sense and respect for everybody, and I think people should do. However, in the hospital, in certain workplaces, I think they will have to still wear masks, and that is important because you're taking care of sick people, right? You just don't know what is going to come to you.
Dr. Gupta, Syracuse.com ran a story about 3 weeks ago showing that nearly 40% of the workers in central New York nursing homes were still not vaccinated. I'm wondering what you and your county peers are doing to try and help get the vaccine to these people and maybe convince them that it's time to get a shot.
So I'm not aware that 40% actually. There was quite hesitancy in the beginning. There are, I will look into that a little bit more. State does provide us some data and also has provided a vaccine to give it to the nursing homes, which we did, I think, a few weeks ago. We gave the last second dose to them. They have been working with the pharmacies at times. They did before. And there's a multiple partner, and also the hub, which is upstate, they are actually work with them too. So there are multiple ways of offering to these nursing homes so that staff can be vaccinated. Again, you're going back to the same question of reluctance, hesitancy, that why, and that goes to the part of the community conversation, that what can employer give some incentive maybe that will be helpful for them. If you look internationally, or some places actually, I think out of state, the restaurants give $500 bonus to get their staff vaccinated, because they say if that's take 10 days or 2 weeks, I have to keep them out. I would rather give them this incentive so I don't have to worry about anything else. So those incentives do work there. I don't know the 40%. I think it's a little bit too much the way I know of the data, but I certainly will have to go back and find that information. But we continue to work with the community throughout for the vaccine hesitancy. And there is plenty of opportunity in our community to get vaccinated, whether at our vaccination site or at the nursing home directly or to the pharmacies. I mean, staff can get anywhere. We are talking residents were the more concerned because they can't go out anywhere. But for the staff, they have plenty of opportunity. We actually have offered them, if you want your staff to come, we can make a separate clinic for them for 10 people or 15 people. This is more of a continued conversation. So we are always there to serve the community.
Doctor, do you have a warning for people who aren't vaccinated who might use the CDC guidance to not wear a mask?
I'll be very concerned because right now what we are seeing, we have a good plateau cases, and I will compare that in India, right? I know that country quite well because I came from there. I grew up there. I have family there, extended family there. And the cases were down, plateaued quite a bit there in September, October somewhere. People had weddings and different things and all sorts of things. And I know I was talking to my family, and vaccinations were offered at times when things were happening. It was a little bit late. People still were not buying into that vaccine. I know I talked to my family members and pretty much convinced them to take the vaccine after juggling around, and it just, one was fine, the second one I had to push it a little bit, third one kind of a little bit pushed more. But before all this happened, but suddenly the hell broke loose, right? One infection, two infection, that's how this virus does. Before you know, and they have the mutant strain. So the lesson which we want to learn, which I think unfortunately nobody wants to learn, I hate to say that, because when it happened in Italy, we didn't learn what happened in New York City. The other part of the countries didn't learn. What happened in India, we are not learning back here. Again, at this point, is we are seeing right now here, we want to have everybody vaccinated to the maximum numbers which we can, so that virus cannot actually come and create problems for us. It needs body to jump from one to another person, right? So if you provide that kind of cover and shield by this by a vaccine and having everybody get vaccinated, majority, I won't say everybody, it will never be 100%, but if you get majority of people vaccinated, then the virus cannot actually find a path in our community. And we might see some low cases, which we can handle it, but we won't see that, and we won't have to give up our normalcy. Our economy won't go down the drain the way it did, and we will have a happy and healthy life, right? That's what I think we are looking for at this point. So I would say be cautious. Please do not go that path, because now it comes back and bites everybody. It's not only them. It will impact their family. It will impact the whole community. It's like a fire. People think in California, some of those places, when they park, they put a little bit of the spark and they're doing a camping. Look what happens, the whole wildfire goes. And that's what the virus is equivalent to, exactly the same way, that it's a matter of time, it creates the problem. So I would say that people take a little bit pause, and first not to do that, to take advantage of that. If they have not taken the vaccine, they are skeptical about it, get the facts, and I hope they will accept it for themselves, essentially, not for anybody else, so they don't have to wear the mask. That's one of the biggest incentive. They can do anything they want, otherwise they want it to do. And lies are not good. I mean, if they are, we have also seen that people are buying those vaccine cards and all. That's not okay. That's not good. That's unethical. That's immoral. Nobody should do that. Not only put your friends and family's life in jeopardy, but rest of the community. And I would ask that people should just, go and get the vaccine. It's there. And we have incentives now, great ones.
So
Dr. Gupta, what would you tell parents with young children who aren't eligible to be vaccinated yet about friends being around them, about people being around them, about them being around their own children?
Yeah. So first is for the parents is that, we are seeing quite enthusiasm from the parents right now for the 12 onwards, which is great. Our clinics actually got sold out pretty fast. We just didn't expect that because we had very plateaued at this point. And now what the concern which I have, I hope it doesn't get kind of down again. So to the parents, I would say that if you are concerned about your child's not only physical health but mental health and having them normalcy in their life, the way to do that is to get vaccine. Not only for them but for also you. Most of it, if the parents have gotten vaccine, hopefully good part of them will go and get for their children, but they still might be skeptical. I know that some parents who have gotten themselves, they are contemplating at this point. I would say look at the data. The data speaks the volume that when these kids, when they got vaccine in the trial, when the FDA looked at the data, and we have that information now, that they actually did prevent significant incidence of any disease or MIS, which is multi-inflammatory syndrome, and there was no deaths in that one, and this will continue to monitor. So, and then also your kids can play and be kids, essentially. That's what I think we all, as a parent, are looking for. So their incentive should be that the kids could be kids back again, and the parents will feel a lot more comfortable, just doing what they are doing it. So that should be a good incentive for them.
What
Dr.
about
Gupta?
fully vaccinated parents? Should they be wearing their masks around their own children? If their children are younger than 12 and are not yet eligible to sign up to be vaccinated, should they be wearing their masks, assuming they're fully vaccinated, around their kids?
So if they're fully vaccinated, most of the time, until we didn't have any, so most of the parents, I do not think they wear masks at home with their children, as long as they are feeling that their kids are being protected. So the public health measure of physical distancing, having their kids mask when they go out and, hanging out with, whether going to school or going to the practice, the sports, or doing whatever the kids do, will be to the most part, or living in a pod of the kids. Like if you know the family and you trust them, you can feel more comfortable around them. So using the same common sense principle will be, and when you add the vaccine for the kids, if they're eligible, that's fantastic. You added that to more security there. So I think creating that environment in which we go back to normal is what we are all looking for. I think you had some back question.
Yeah, thank you. I just wanted to follow up and ask how your family's doing in India.
My family, thank you for asking. My family, my immediate family is doing great. I kind of try to check on. Some people get impacted by it and, again, recovering, which is good. Some of my friends, and people have lost life. And it has been very hard. When you think of that, when there is a vaccine was there, and there was no public health measures were followed by people. It just pretty much, when I was seeing some of the weddings and different things and how it was happening, it was so disheartening. So thank you for asking. Yes, they are doing okay. And I just continue to remind them it's here, so don't go out, don't do these things, and a lot of don'ts. So they do listen.
Doctor, are you aware of any vaccinated people being diagnosed with coronavirus? Fully vaccinated?
Yes, we have. We find those, as you can see, that Johnson & Johnson is about 85%, and you have Moderna and Pfizer about 94-95%. So you will have people who will, despite a full vaccination, will become positive. So we have seen that in our community ourselves also. Yeah.
Like dozens of cases?
Very small. Yeah. Okay.
County Executive,
Thank
this
you.
is a bit off topic, but the Sheriff's Department is down 72 positions from this time last year, according to your adopted 2021 budget. Is there any plans, has the Sheriff reached out to you and requested the ability to hold a patrol academy?
Not yet. I would anticipate in the budget in 2022, we'll need to put forward a class. The size of the class certainly would need to be looked at. There's two things, remember, at the Sheriff's Department. You have your deputies, your road patrol division, where the workflow is consistent and constant. Then you have the corrections side. On the corrections side, the reality is jails are 50 to 75% less occupied than they were years ago after various laws that were passed in Albany. So I don't know, out of the 75, how much are on the corrections side? The reality is those positions probably aren't needed. So that's, we'll have that discussion moving forward. But on the deputy side, I do anticipate the sheriff will need another class. You have retirements. So when we had the retirement incentives in 2020, his department was not immune from that. And so certainly we anticipate that. We'll support that. And then we'll work with the Sheriff's Department with our Office of Diversity and Inclusion to try to recruit candidates to make sure that that class is representative of the entire county.
And then is there any update, I know there wasn't one last week, but is there any update on where we are in the body camera process?
Yeah, so I think we're going to have, I'll check in related to, is today Thursday? So Monday I'll talk about where we are at the procurement of that. Certainly we'll have a competitive process for companies to come forward. There's companies that have the SPD uses, and then obviously our district attorney's office is comfortable with. But there are other companies that may be more cost effective or have newer technology or have the same technology. Remember, we didn't just give them body cameras. He asked for cameras in the vehicles. We gave them vehicle cameras for 69 vehicles as well. So that technology certainly needs to interface. So we'll move forward. I think we'll probably have the procurement ready to go on that next week if it's not already ready.
Dr. Gupta, there's one more question from my newsroom that came to my phone. Can I have you step back up? I'm so sorry. Can I have you step back up to the podium?
Terry, do you have one for me before
Yeah,
that?
I do.
Okay.
It's a much lighter question.
Yes.
What is Patton Oswald doing at Shoppingtown Mall?
Look, they've heard a lot about the RFP we have going on out there at Shoppingtown. So I think he was taking a look at it. We've been very, there's been a lot of work for a couple of years now, Terry, in the film industry. And this is probably a success story in our community that's been under the radar a lot. So certainly we're a great place to shoot a film, and I can't confirm or deny that's why he's there, but I think you got the point, right? Dr. Gupta, you going to close us out? There you go. Come on back. Yeah.
This is directly from my newsroom. I apologize for calling you back up. I'm going to read it verbatim. If fully vaccinated people can still transmit the virus to other people like their kids, can people who are still fully vaccinated transmit the virus to other people like their kids if they're too young to get the vaccine? So can parents, in essence, can they transmit the virus to their children?
Right.
If they are
fully vaxxed. So this is kind of still being debated at this point, that if they can transmit the virus. So fully vaccinated people that is not fully answered, not that I know of at this point. The data is still out there that we don't know fully if you're fully vaccinated. If you got COVID, for whatever reason, can you transmit that to your child? For the most part, there's not a whole lot of information about at this point, and I think this is something we are going to be looking for more information from both from the state and the CDC, because all our information, which goes from the case investigation, goes to the state, then it gets compiled into the CDC. So when the CDC gets you the full data, it's coming from each state. So right now in our community, which anecdotally I can say that we have not seen any of these things in our community, but again, we are talking a very, very, very small number of people. Right now, that's not, information is not available at this point.